What measures can reduce the risk of staff falling asleep during shifts when supporting clients in their own homes?
Okay, so again, this will ultimately come back down to our policy, right? Because we need to consider what is the impact of a care assistant or one of our employees falling asleep whilst, on site and working ultimately. Well, the implication could potentially be death. It could also be adverse reflection on the service via a death or via an accident. So within that safeguarding policy, I would expect it to, overview that, again, we can't be falling asleep at a bare minimum, potentially implementing procedures for employees to complete tasks or to complete or to at least feedback or to provide, an hourly, a 2-hourly update with respect to, whether, even if that's done relatively informally via WhatsApp or it's logged more formally via an online system. Could we develop pragmatic systems in terms of, this is what I want you to do throughout this period. At this time, you're to check this and you're to record it this way via this system. At the next, in 2 hours time beyond that, I want you to check this and to record your findings on this. So developing ways in which we can make sure that they're awake and have reporting mechanisms around that. But I would also be writing that within my conduct policy, because again, this is an issue that you would treat on a spectrum. Dependent on the possible severity, ultimately would determine the outcome. If someone were to fall asleep whilst on shift and a service user fell and they were unable to receive any care, potentially resulted in a broken hip of a service user, that's going to be extremely detrimental to an organisation, especially if you have extremely strong values as, to putting the service user first. So again, let's have a look at the safeguarding policy. Let's develop some supporting procedures around that, whether it be, again, recording things, whether it be to just check in and say, right, I've done my X check at this time. This way we know that people are awake. It's entirely unreasonable to, sit with an employee to make sure that they're not falling asleep, but it would be deemed as reasonable to have at least a strategy to ensure that we are providing the highest level of care. And I feel that that's something that every care provider should strive and aim for.